I had a teacher once who said, "Your normal is not normal for me. What's normal for me is abnormal for you." And for the 24 million Americans who suffer with an eating disorder, their normal is living with the ins and outs of a mental illness. Hi, I'm Michelle, and today we're going to talk about the different types of treatments available for eating disorders. Let's face the facts. Not everyone with an eating disorder ends up inpatient or in a documentary. Most end up going through nutrition counseling and therapy. Nutrition counseling is used to promote healthy eating. There are 3 different approaches used, whether it's a meal plan, the exchange system, or something known as intuitive eating. A meal plan is a set of specific foods and specific calories required for each meal. This is based off of the body weight. Typically, your body needs between 15 to 2,000 calories in order to maintain your breathing, heart rate, digestion, and other bodily functions. Your basal metabolic rate is the amount of calories needed to maintain your body function and your set point. A set point is the natural weight in which your body is in equilibrium. Severe cases of anorexia nervosa need to be placed on the highest level of care through the meal plan, most commonly known as weight restoration. The primary goal of the weight restoration meal plan is to return the anorectic to their set point, or target weight. A target weight is typically devised by the treatment team and is usually around the individual set point. The second system of nutrition counseling is the exchange system. This system is comprised of a series of exchanges in which the individual is required to meet per meal. An exchange might be a certain number of carbohydrates, proteins, healthy fats, veggies, or fruits that are required each meal. Eating disorder clinics such as the Renfrew Center use this form of treatment. The third approach to nutrition counseling is something known as intuitive eating. Intuitive eating calls the individual to get in touch with their body and listen in for hunger signals. By doing so, the individual is given responsibility of their body to recognize their hunger systems and to fuel their body appropriately. This is the hardest form of treatment in the beginning for eating disorders because, as often occurs, the individual with the eating disorder has lost awareness of their hunger signals, not knowing when they are hungry and when they are sufficiently full. Thus, they might lie, saying that they are either not hungry or full. Next, the individual engages in therapy. There are 3 main approaches of therapy that are used: cognitive behavioral therapy, or CBT, mindfulness approach, or rational emotional behavioral therapy, REBT. Typically, therapy sessions are on an individual, group, or family basis. The National Center for Biotechnology Information has researched and proved that cognitive behavioral therapy, CBT, is effective use for recovering bulimics and outpatient treatment for anorexics. In this, individuals challenge their thoughts, feelings, and emotions in order to modify their behavior. Next is the mindfulness approach. This approach is based in ancient rites that can be found in both yoga and world religions such as Buddhism, Islam, and Christianity. By bringing the awareness to the present moment, the individual is able to get in contact with their body. Your breathing, heartbeat, and body pressure against your seat allows you to focus on reality instead of the distortions that are plaguing the individual's thoughts. This approach is linked with intuitive eating because both require the individual to get in contact with their body and bring them into the present moment. Next is rational emotional behavioral therapy, REBT. REBT is similar to CBT in the basis that it evaluates thoughts and emotions in order to modify behaviors. This approach, however, requires the individual to work through their thoughts on a series of how severe it is, not only in their own life, but how severe it is in the world events, such as the thought of being not thin enough in order to restrict, and the thought of a world war breaking out. Through nutrition counseling and therapy, eating disorders can be treated. That's all we have time for today. If you have any questions, please feel free to comment below. Happy National Eating Disorder Awareness Week, and look forward to more videos. Bye!